Franklin Memorial Hospital is a 65-bed independent sole community not-for-profit hospital in the rural western mountains of Maine. My organization serves 40,000 people who live throughout a 2,800 square mile area from central Maine to the Canadian border. The hospital service area makes up 8% of the entire state of Maine. In addition to inpatient and outpatient services, the organization provides the emergency services in the community to this wide geographic area. The hospital also employs 85% of the physicians in the community. This employment trend has occurred over the past 10 years, as private physicians have not been able to make it in the community financially. The hospital has stepped up to the plate and employed physicians not by strategic design, but out of necessity to assure that the medical services are available to people in the community. Without employment by the hospital, physicians would have left the area. Our focus as an organization is on the provision of cost-effective primary care with an emphasis on minimizing the use of expensive hospital services. Franklin Memorial's primary care physicians are very skilled at doing this. My physicians have been practicing accountable care before it was the popular thing to do. Over the past 12 months, we have decreased the overall utilization of our emergency department by 7% through a concerted effort to make certain that our primary care practices provide same-day access to patients with medical needs. Our physicians do not want their patients going to the emergency department unnecessarily. When patients do come to the emergency department, if they don't have an established relationship with a primary care provider, we help them obtain that. This dramatic decrease in emergency department utilization has actually had a significant negative financial impact on my hospital. But it's my belief and the belief of my community board of directors that it is the right thing to do. Decreasing expensive emergency department services by promoting primary care in the community is the right thing. We are committed to that, even if it financially disadvantages my organization. During the past 15 months, my hospital has also decreased its 30-day readmission rate from 18% to 9%. We have done this through the efforts of our primary care practices. When a patient is discharged from the hospital, a nurse from the primary care practice calls the patient within 24 or 48 hours of discharge. All complex patients are seen by their primary care physician within 7 days, or sooner if necessary. This concerted effort by the primary care physicians in the community have helped us cut our 30-day readmission rate in half. Provider-based status allows Franklin Memorial Hospital to assure access to primary care and other medical specialty services in a very rural area. If this additional reimbursement to my hospital is eliminated, 4 things will happen. First, the organization will be forced to reduce the number of primary care physicians in the service area. Secondly, access to services for Medicare, Medicaid, and charity care patients will be reduced, with the emergency department becoming the fallback position. Number 3, the progress we have made in delivering medical services in an accountable care fashion will not be sustainable. And lastly, my organization's ability to recruit replacement physicians in the future will be negatively impacted. Thank you.